Hi, my name is Bert Martin from North Vista Hospital. Today we're going to be talking about what we call EHAC, Early Heart Attack Care. So this will be times when you may find somebody in your household or in the shopping mall, or someone may have fallen, collapsed, or complaining of chest pain and a possible heart attack. Okay?
Well, thank you, Bert. We really appreciate your time. We just have a few questions here so people can understand. So what are the risk factors for cardiovascular disease?
Well, some of the most common risk factors for cardio or heart disease, cardiovascular disease, is going to be lifestyle choices, much of the time. Do you smoke? Smoking is one of the primary risk factors. Are you overweight? Do you have diabetes? Do you have high blood pressure? Do you have high cholesterol? These are some of the risk factors that can lead to possibly cardiac disease or a possible heart attack. Also, what type of lifestyle do you do? Are you active? Do you spend time every day moving? Do you sit in your chair and watch TV all day long? Do you sit at a desk and do just computer work all day long? You've got to get up and move.
What are the signs and symptoms of acute coronary syndrome, or also known as ACS?
Okay. Acute coronary syndrome, or some of the signs and symptoms of those, could involve, well, they're going to be different for men and women. They're going to have some similarities, and then they can be different. The biggest one that you're going to find that can present most of the time is someone's going to complain of some chest pain. You might get, a man especially will complain of chest pain. Sometimes you're going to feel nauseated. You may get real diaphoretic. You're going to have some shortness of breath. You might feel a little bit of chest pain or squeezing in your chest. And this is like almost people, when they have a heart attack, they will say that someone is sitting on their chest. They have an elephant sitting on their chest. Okay, that could be a sign of it. Some of them, women are a little bit different. Sometimes they don't always get chest pain. They may feel a little bit of indigestion. They may feel some nauseousness. Sometimes they may complain of extreme fatigue. So those are some of the differences with women, in addition to the other ones that we've already talked about. The women can also faint.
Tell us, Bert, what is the importance of calling 911?
Well, many times when somebody is having a heart attack, that means that their heart is not beating correctly, that for whatever reason. They've got, and when you, if it's a lack of oxygen, maybe they've got a blockage or something going on, it's causing, but their heart can basically go into what we call an irregular rhythm. Irregular rhythms can progress. They can go from mild symptoms to where basically then the heart stops beating properly. Goes into what we call fibrillation. If somebody goes into fibrillation, they need EMS there to deliver electrical shocks, basically to defib the heart, to try to reset the heart. And that can only be done with EMS personnel.
So with that, can you show us how we can do hands-only CPR?
Sure, you bet. So we've got a scenario here. We'll start off by, you hear your dad, he hollers out, you come in, you run into the room and you find him and he's laying on the floor. Okay, you find him down on the floor. First thing you want to do is make sure Dad's just not sleeping. So you're going to go up and you're going to kind of shake him a little bit. Hey Dad, how you doing? You okay? Are you okay? If he doesn't respond, the first thing I want you to do is to feel for a pulse. Now you've got some places in your body where you can feel for a pulse. This is called the carotid artery. And if you would do it on yourself, you feel alongside your neck, but you're going to take and you're going to feel for a pulse on his neck. You're going to wait for 6 to 10 seconds. While you're down there, I just want you to kind of look and see if you see his chest going up and down. If you feel no pulse, then what I want you to do is what we call compressions. This is the most important part of what we call basic life saving, and the one that's going to make the most difference in the house until EMS gets here. But we do want to get EMS going, so if he's not responding and I'm feeling for a pulse, I'm also yelling, "Help! Somebody get up here!" Once they get here, I want them to activate EMS. The way you're going to do that at home is you're going to dial 911. Vitally important that you get the EMS people here right away, because we need advanced life-saving stuff going. But that doesn't mean you can't do anything. You get started with compressions. So if you don't feel a pulse, then what I want you to do is to take your a hand that's away from you, you know, went up on your neck. I want you to put on his rib cage. Bring it up to the center breastbone. Right in the center of the breastbone, I want you to feel for the bottom of it. And then I want you to put your fingers on right above your palm of your hand down on top of that. And I want you to start doing compressions. You're going to be pushing hard and pushing fast at a count of, usually we do this 32, but right now I just want you to focus on compressing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And then you just keep pushing as much as you can. 20, 21, 22, 23, 24, 25. You want to get a depth of at least 2 inches. So you're going to be having to really get on there, lock those elbows out, and push straight down. 29, 30, 31, 32. You just keep pushing. You don't even have to really keep count. I just want you pushing, 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 getting good depth. Some of the things that's going to help you to do a better job is you're going to bend, kind of relax your knees a bit, but you're just going to get your body up over top and just pushing straight down. Hard, fast, and to a depth of about 2 inches. You're going to keep doing that until EMS gets here. Once EMS, the emergency medical system, gets here, they are going to then take over and you can relax. Very important though that you get EMS on scene. Now if you are in say a mall and your mom or your dad collapses while you're out shopping, they fall down. Mom, you okay? Dad, you okay? Help! Again, feeling for a pulse. No pulse. Somebody call 911. Now, and go ahead and do everything I said before. Put your hands on their chest, find their breastbone. Heel the hand above the fingers there, center of the chest, start pushing. Call for 911, you begin compressions. Also, check to see if there's what's called an AED in the store. A lot of places, especially here in Las Vegas, casinos, stores, shopping malls, they will have what's called an AED. A little bit about CPR, basic life-saving, you know, the compressions and everything. We have a scenario sometimes when we're in a mall. Oh, sorry, I dropped this down. When we're in a mall, maybe you're in a shopping store, you're in a casino. If you should happen to notice that your mom or your dad or somebody has fallen down and they're non-responsive and you've activated the EMS system, the other thing that you may want to ask for to have them bring, as well as calling 911, is to bring the AED, which stands for Automatic External Defibrillator. We talked about it a little bit before that sometimes when people have collapse or they may have a heart attack, it's because their heart is in an irregular rhythm. So getting an AED, Automatic External Defibrillator, there on scene quickly and following the instructions that it'll prompt you through can help save a patient's life by you being able to provide defibrillation to help get that heart rate back into a normal rhythm.